The ayes have it.
Children in hospital for extended periods. Report to Parliament Bill. Second reading.
Sir Oliver Heald.
Mr Deputy Speaker, I beg to move that the bill be now read a second time. I started the journey with this bill with a 10-minute rule bill application on the 20th of June last year. I published the bill, which is in the same terms as it was in the last session. I published it in September, but there were no dates left for a debate, and so I'm pleased to put the bill forward again in this session. I was delighted at that time to have the heavyweight support from all parts of the House, my honourable friend for Sleaford and North Hykeham, who's a consultant paediatrician, senior Labour figures such as the honourable member for Derby South, and my old friend the honourable member for Eltham, and the former shadow leader of the House, the honourable member for Walsall South, as well as many other senior and upcoming colleagues. The bill would require the Secretary of State to report to Parliament on the merits of providing financial support for parents of children receiving care in hospital for extended periods. The bill has had considerable media interest and public support, and I would like to thank ministers for engaging with me on this, particularly the Secretary of State for Work and Pensions and the Minister of State here today for Bury St Edmunds, who has personal experience of some of the issues that I'm coming to. I've also had engagement with the Department of Health and Social Care and welcome the fact that the Minister of State has taken an interest in this. As I explained last June, my constituent Kerry Menai-Davis contacted me after the loss of his 6-year-old son Hugh to a rare cancer on the 18th of September 2021. He and his wife Frances are in the gallery today. They had a terrible ordeal for more than 10 months, attending hospital and at times commuting daily as they watched their son rapidly decline over a number of months in hospital from being a sporty youngster who Mr Menai-Davis was teaching golf to his sad passing. And when Mr Menai-Davis contacted me at the end of 2021, he and his wife had just set up a charity called It's Never You. And these are the words that Mrs Menai-Davis, Frances, said to her husband when they got the diagnosis. They wanted to help parents of very ill children in hospital with mental and physical support and to call for some financial help too. Cases where children are in hospital for extended periods are rare. The reply I received to a written question showed there were about 4,000 children a year who spend more than 2 months continuously in hospital. And this can involve the parents visiting hospital every day or even staying in a flat provided for parents at the hospital. He asked if I could arrange for him to meet a health minister to lobby for better care of parents. And I would say that this has never just been about money. It's also been about wanting government to look holistically into how parents are supported in these difficult periods. I did that, and the then Minister of State, who was my right honourable friend, the member for Charnwood, held a meeting with us on the 24th of March 2022, where he heard about a range of practical problems with care for parents in hospital, which included issues like being able to access food at the weekend, but also mental and emotional support, because what a lot of these parents are going through is the most dreadful ordeal. And the Minister asked for full details, which we sent to him with the idea of informing the work on the new generation of children's hospitals, including on the facilities there for parents of very sick children. He responded constructively on issues of outreach to parents, food for parents staying in hospital with children, improved facilities for families in the new hospitals programme, and linking NHS charities with the work of It's Never You, their charity. Through my constituents' charity, parents or guardians of sick children benefit by connecting with a community of peers, finding support, moral support, sharing experiences and getting professionally sourced and reliable information through a social network. There's a blog and an app. This is not done by the statutory authorities, but through the Children's Cancer Platform, which is the UK's only platform built exclusively to support parents in this difficult situation. The charity has started to put wellbeing bags into hospitals such as Addenbrooke's in Cambridge, Great Ormond Street and others, and they're well received. And it's also present the charity in Manchester, Birmingham, Cardiff, Leeds and other places. It's partnered with several charities across the UK and aims to form an umbrella where all relevant charities can be found in one place. Addenbrooke's in Cambridge is, of course, the major hospital for East Anglia, and it's well known to the Minister and I because it's our regional hospital. It's also the site for a proposed new children's hospital, a project I've strongly supported, in part because the East of England is the only part of the country, the only region, which doesn't currently have a children's hospital. But Cambridge Children's Hospital will be available to provide care for every child and young person in the region and provide the level of care that families need without having to travel hundreds of miles. It'll also be the first hospital in the world that fully integrates mental and physical health provision so that young people and their families have complete and seamless care according to their needs. This will be underpinned by world-class research in child health and genomics. There'll be more provision for intensive care. There'll be specialist wards, which will provide children in crisis with safe spaces, and dedicated operating theatres will facilitate thousands of life-saving procedures. It'll be a Cambridge University research facility. It'll integrate cutting-edge treatments and technology, bringing physical and mental health together and using genomic medicine to not just treat diseases but prevent them. It'll put the child at the centre of everything, draw on telehealth technology to connect people beyond the walls. In October, the plans at Addenbrooke's for this specialist hospital got a new milestone as the green light was given to proceed to the final stage of its business case. Dr. Rob Hushkell, the clinical lead for physical health at the hospital, said, "We know there's widespread support across the east of England for this hospital, from children and their families to our regional colleagues and our regional MPs. Now is the time for us all to work together to turn our plans into reality. I can't wait to get started on the next stage of the project." Now, this hospital is provisionally due to open in Cambridge in 2025, and credit must go to the former Secretary of State, my right honourable friend for West Suffolk, because he approved the building of this hospital and committed public funds. The honourable member for Cambridge, who was with us earlier, said in a press release that this next stage is in establishing a world-class children's facility for the region. After our meeting with the Health Minister, honourable member for Charnwood, it was arranged by Nick Kirby, the Executive Director at Addenbrooke's, for Mr Menai Davis to share his information about what parents need with the Children's Hospital team for this new cutting-edge hospital. And they've had productive meetings with him in which he shared insights, and the team have described this to me as inspiring. It was confirmed to me recently by Chris McNicholas, who's the Deputy Project Director, that next steps would include how best to deliver psychological support to parents and also to link with the charities, blog and app. Before returning to the financial aspect, I'd also like to mention the need for improvements in cancer care more generally. As well as exciting new hospitals, primary care needs to come up to standard as well. On the 19th of November 2021, I spoke in a debate called by my honourable friend for Hertford and Stortford about cancer awareness and diagnosis for young people after the sad death of Jessica Brady, a young satellite engineer, to a rare cancer, and the campaign of her parents, who are my constituents. And my honourable friend, Simon and Andrea Brady, and I delivered a petition with 213,000 signatures to Downing Street. Jessica's cancer had been misdiagnosed on several occasions, and sadly, this very clever young woman had died. Yes, indeed.
I thank my right honourable friend for giving way. Would he agree with me that it is incredibly powerful of parents who themselves are suffering and have challenges. I heard Kerry Menai-Davis speaking this morning on breakfast television, and the question was raised, is it right for people with lived experience, should they be the ones that make the changes in the laws that we make? I have in my constituency the Harper Lee tragedy of a child who died following swallowing a button battery, and her mother, Stacey, has campaigned for 2.5 years for Harper Lee's law. I think it is, I just wanted to, with you, hopefully give a shout out to all those fantastic parents who, without whose work we as parliamentarians would not be able to do our jobs.
Well, can I just agree completely and to say that given the tragedy that they had, it would have been possible for Kerry and Francis Menai-Davis to simply collapse, but they didn't. They decided they were going to do something positive. They set up the charity, and the enthusiasm and strength of determination which that couple bring to this is something to be seen, and I certainly pay tribute to them. But my right honourable friend for Charnwood, he responded to the debate by explaining that we are working on achieving better long-term plans on early diagnosis of cancer, including rarer cancers, and to try and avoid what happened to Jessica happening again. Hertfordshire's hospital trusts are working extremely hard on this. The government has this aim of diagnosing 3/4 of cancers at stage 1 or 2, and an additional 55,000 people would then survive cancer for 5 years longer than they do now. So alongside new hospitals, we do need to also see this improvement in diagnosis. Now, one of the things which is improving this is rapid diagnosis centres and services, which are an important part of what the new ICBs, integrated care boards, what they're pressing for. And there are 102 live rapid diagnostic centre pathways currently. It's also right to say that the Eastern North Hertfordshire NHS Trust, informed by experiences such as Jessica's and also bearing in mind what's happened in the case of Hugh, they are also working to have a much more coordinated multidisciplinary approach. But what this shows is that we're at the start of a new era with better hospital services and an understanding of the need to prioritise cancer, not just in the elderly, but also in the young, and not just the best-known cancers, but the rare ones too. And I'd also like to pay tribute to the work of the all-party group on rare cancers, which I support. The aspect of this bill raised by my constituent is the financial aspect on parents of having to spend months in hospital supporting sick young children. My constituent is self-employed. It cost him a lot to put his child first, but he was able to manage not only because of his strong personal finances, but also the support of his family in keeping his business going. But he did fear for others who were less fortunate and found themselves in the same position. He gave me examples of people his charity is helping and of people losing their livelihoods to support their children in hospital. As I've indicated, I have raised the financial issue with ministers in the Department for Work and Pensions and the Department for Health and Social Care, and I have been pointed to some limited help, such as parents being able to use leave entitlements, often unpaid. There's also bereavement leave. We've been pointed to universal credit, where, of course, if income goes down, the benefit goes up. Parents who have worked for the same employer for at least a year are entitled to 18 weeks unpaid parental leave, and there may be help from disability and carers benefits after a period. In this bill, I'm asking for a report to be made to Parliament by the Secretary of State on the merits of providing financial support for parents of children receiving care in hospital for extended periods. I'm asking for an assessment of current policies, the likely effect of some additional support on both parents and children. I'm asking for the government to consult parents, healthcare professionals, charities and others offering support. And although it's never you as the focus of what Kerry and Francis are doing. I've also heard from other charities, such as Together for Short Lives, who talk about the huge financial strain on families of a child in hospital, and Young Lives Against Cancer, who have a particular issue which they wanted me to raise, which is that the NHS does offer a healthcare travel cost support scheme, but apparently the operation of it is not very helpful because it's ponderous and doesn't deliver the money quickly enough. So perhaps that's something that the report could look into. I hope it's also going to be possible for a meeting between the Minister and Mr. and Mrs. Menai-Davis so that they can explain what they hoped to get from this process. But the bill wouldn't cost a great deal as there are so few cases. But it would mean that in tragic circumstances, all parents could concentrate on helping their children rather than worrying about money. In a way, the bill is also about Kerry Menai-Davis' wife, Frances, being able to help other parents who find themselves in the situation they found themselves in. The report is likely to touch on some of the other issues families have taken up with ministers and that I've raised in my remarks. I hope this could inform a holistic approach to improving care for young cancer patients and their parents. It would be a legacy for Hugh, and I think we could call it Hugh's report.
Is that the bill be now read a second time? Opposition front bench.
Thank you, Mr. Deputy Speaker. And I just want to congratulate the Honourable Member for North East Hertfordshire for putting forward such articulate arguments. I hope that you don't mistake my brevity for not being absolutely serious in terms of stuff, but I'm absolutely certain that the member wants to hear from the Minister, and the families in the gallery also do. So I'm just going to leave my remarks there. I'm happy to share my notes that I did have prepared if the Honourable Member would like them, and we will be supporting this bill.
Minister, Joe Churchill.
Thank you very much indeed, Mr. Deputy Speaker, and I thank the Right Honourable Lady. Firstly, I'd like to thank and congratulate the Right Honourable Member for North East Hertfordshire for bringing this important issue to the floor of the House. I know, as he's explained today in conversations with me, that when Kerry and Francis contacted him after the tragic loss of their son Hugh to a rare cancer at the tender age of 6, he was motivated to see how he could help ensure parents are supported at such a difficult time. I know I speak for everyone in this place when I say that our hearts go out to you. I was moved when I read the Right Honourable Gentleman's speech from last September and again today, and I understood personally the disbelief behind the words of Frances in the name she has given to their charity. To help parents of very ill children who are in hospital for extended periods, it's never you. The challenge is, sometimes it is. The purpose behind the bill is to enable research and produce a report into both the emotional and tangible support available and needed, like the charity is giving, but looking at things in a more joined-up way to work better and more effectively for parents during those difficult times. I stand here as somebody who has had cancer more than once. You don't choose it, it chooses you. As Kerry and Francis know, your world is turned upside down. Your days are driven by medical appointments, a need to have questions answered, juggling life's issues alongside wanting to do anything to try and protect your child and make the pain go away. My right honourable friend has spoken to me about Kerry and Francis' motivation to do something for those parents who have also travelled the journey of their child, having an extended period in hospital, and some of the worries this brings financially, emotionally, and physically. I would just like to take a brief moment to lay out what support is already available, but I will do it very rapidly because my right honourable friend went over it. There is help there to deal with some of the financial worries. The Disabled Child Edition is available to low-income families on universal credit who are entitled to qualifying disability benefits such as the Child Disability Living Allowance. A parent of a child who qualifies for this support, where they and their partner are providing at least 35 hours of care each week, can also claim carers allowance as a result of their additional responsibilities. There is additional support available to families on universal credit who may need further help. And for those families sadly affected by bereavement, there are funds in England and Scotland to help with funeral expenses. If you're on universal credit, an open discussion with your supporting work coach allows for health and caring responsibilities to be accounted for and enables access to support. I noted that Kerry has worked with Edmunds Hospital to share his and Frances's experience to inform the team as they plan the new children's hospital, and I know that the hospital have been keen to ensure families and patients feed their experience in alongside clinicians. They're a pioneering world-first model of care that looks to treat the whole child, both their physical and emotional needs, as well as providing that paediatric genomic medicine. But behind every young patient, wherever they are treated, right across the country, is a family. And I recognise how difficult it is to navigate both the practical and emotional challenges. That is why It's Never You and charities like them make a huge difference and play a pivotal role in supporting families, and I would like to thank all of them for the work they do and reiterate the words of my honourable friend from Stoke-on-Trent, that parents' voices are so important. Hopefully I have the House's support, having already spoken to the Health Minister with responsibility to ensure we can work closely. The Right Honourable Member for Pendle, he has assured me he stands ready to look at what can be done and to support us in making sure that the right conversations are held. I know it's charities like It's Never You that are most often helping parents access practical support and connect with other families going through the comparable experiences, gaining moral support from each other and love, sharing ways to overcome issues and to stop that pain of thinking you're the only one. While I know nothing stops the lying awake at night, watching the clock tick through the hours while you hope for miracles. But we want to help families going through these difficult times. I would like to commit from the dispatch box to work closely with my right honourable friend on this important issue. In particular, we are committing to establishing a stakeholder forum in order to consult with parents whose children have received care in hospital for an extended period, to consult with healthcare professionals and charities and civil societies and organisations offering support in the area. We want to hear people's experiences, understand their concerns, listen to ideas and suggestions, then develop a set of potential proposals based on the feedback. I would like to suggest that a meeting is arranged with my office at the earliest opportunity so Kerry and Frances's knowledge can help drive and help determine who will be key to that consultation. I will personally ensure the forum is established in a timely manner and progresses quicker than a legislative route would allow. To that end, I would like to suggest to my right honourable friend that he withdraws the bill. We begin discussions now, and in the words of Kerry, that there is purpose to the pain. I thank you.
For the Leave of the House, Sir Oliver Heald.
Well, Mr Deputy Speaker, I'm delighted by the response, which is basically giving me what I asked for in the bill. But of course, if I was to go through the whole process of going through this House at every stage and then the House of Lords, it would take many months before we could start this process. And I think my right honourable friend did say to me that she would hope to meet the 6-month period for the report at the end. So on that basis, I am delighted, and I think this is short-circuiting the process. So I would beg leave to withdraw my bill and go forward with the proposal.
Is it your pleasure that the motion be withdrawn? Aye. Motion by Lee withdrawn.
Arms Trade, Inquiry and Suspension Bill, second reading.
Okay, that's time.
Order. Technically. Bear with me. It is second reading what day?
Friday the 1st of March.
Friday the 3rd of March. 1st of March. Beg your pardon. Thank you.
Multi-storey car parks safety bill, second reading.
Object.
Objection taken. Second reading what day?
Friday the 23rd of February, Mr Deputy Speaker.
Friday the 23rd of February.
Pets microchips bill, second reading.
Object.
Objection taken. Second reading what day?
Friday the 26th of January.
Friday the 20th of January.
Landlord and Tenant Act 1985 Amendment Bill, second reading.
On behalf of the member in charge, now.
Object.
Objection taken. Second reading what day?
Friday, 1st of March.
Friday the 1st of March.
Zoological Society of London Leases Bill, second reading.
Now.
The question is that the bill be now read a second time. As many of that opinion say aye. Aye. Contrary, no. The ayes have it.
Commonwealth Parliamentary Association and International Committee of the Red Cross Status Bill, second reading.
Now.
Second reading, question, I beg your pardon, second reading what day?
No, the question is...
I beg your pardon. The question is that the bill be now read a second time. As many of that opinion say aye. Aye. No, the ayes have it.
I beg to move that this House be now adjourned.